Welcome, Jim. We are joined with Jim Wieberg and his partner, Heather Johns, with the Missouri Physicians and Health Professionals Wellness Program. Heather is actually in a different meeting, so she's just joining us in spirit, but I've really been connecting with both Jim and Heather as I've been setting up this presentation for everyone. And we're just going to get started. I have some questions for Jim. I'm going to be his audience while he delivers the PowerPoint that you all would have seen if he was to come in person. And I'm going to ask all the important questions that hopefully everyone's thinking so that we can all learn about this together. So welcome, Jim. Let's have it.
All right. All right. As you and I have discussed, the origins for this particular program is the fact that life can be difficult, and those difficulties can jump up and bite us irregardless of who we are and where we are. And sometimes those difficulties can make life doubly difficult personally, emotionally, can impact our family life, our personal life, can impact our job, and when life's difficulties impact us in our careers and our jobs particularly, we provide some resources to make assessments, provide treatment opportunities where that's necessary, and help people get back on their feet so that they can continue their careers, and to assure the patient community and the medical community that we who are in the medical profession, that we are capable and qualified to provide safe and complete medical treatment as we do our jobs. And our program is there to help people, one, get well if they're broken, and then once they get well, to help them maintain their wellness in the process of resuming their work life. So I'm going to move along here. As I've mentioned to Mary, we started this work in 1987 at the request of the Osteopathic Association, which is how we got our connections to MAOPS. And in the years that followed, we began to take on other allied health besides physicians. We see not only DOs, but we also see MDs in our program. But the allied professionals are the folks who came in the mid-90s and became a part of our program, including PAs, athletic trainers, speech therapists, physical therapists, all those folks who are licensed by the board, pretty much as you all are as anesthesia assistants. And one of the things I'd suggest that you consider while we're talking about impairment and the fact that life is difficult and some of us get knocked down by some of those difficulties, never say never. Never say it'll never happen to you. Because I'm here to tell you it can happen to any of us, and it can happen at any time. And the message in our program today is that when and if it happens to you, is you don't have to do it yourself. Or as I'm wont to say from Argyle, Missouri, you don't got to do it alone. And my English teacher would just roll over in her grave if she heard me say that. But it's reality. We don't have to do this stuff on our own. There's help available. And that's who we are. That's what we do. We serve as advocates for medical personnel, helping them get well and stay well. We advocate, and by advocating, as we indicate, it's about a labor of love and not about a labor of law. There are plenty of people around you who are going to be eager to make sure that you toe the line in terms of the law. Our job is to humanly touch you, embrace you, help you take care of your issues, seek treatment in whatever form you might need it, and then pick yourself up and get back out there. And we journey with you through that whole process. Or as I often suggest, my job is to ride in the hip pockets of the people who are in our program. That's how close we connect to you. We've helped lots of physicians over the years, hundreds and hundreds of them, as well as other allied health professionals. In the 90s, the AMA declared that all of us who work in healthcare are responsible for each other's well-being. And I can tell you, among physicians in the early 90s, that's what really drove them to want to create a program to to provide help for their colleagues who needed help. It was this declaration by the AMA that really drove them and continues to drive them today, which really warms my heart regarding the osteopathic profession, because they heard the message and they're trying to do something about it, and that is to take care of their own. But I want you to be aware that as you look around your classroom today, if you are all are in the classroom listening to this, to look at each other and be aware that you are responsible for each other. And that's a responsibility that we have to take very seriously, because in our working together, in our connecting and providing healthcare, we're going to become keenly aware of each other and each other's struggles and difficulties, and sometimes helping others around us to deal with their issues is a tremendous healthcare responsibility that really contributes to the well-being of the health community. We do two things basically. We do remediation, and that is we take broken people and try to fix them, and then we work on prevention, doing what we can to help people avoid the pitfalls that are out there and stay away from the things that can create difficulty. And that's a little bit of what's behind what we're doing here today, is giving you some heads up about some things that the Board of Healing Arts suggests that you be aware of as you walk out there in your profession. And so we do make pretty serious attempts at doing prevention programs as well as fixing broken people.
I have a question, Jim.
You got me, Mary.
For the students who are listening, if they notice that one of their colleagues is struggling while everyone's still in school, do you have any suggestion on the procedure of what that student who notices that someone's maybe struggling with an addiction, or maybe it's not a full-blown, that it's not that obvious, but they're struggling, if they should tell someone in the school, or if they should go to you, or if there's any recommendations you have there?
Well, again, I would begin with going to someone there at the school. That's the recommendation that we give to the medical students there at UMKC. There are resources in your institution that's provided for students.
Yeah.
Now, there's sometimes reluctance to access that resource because the fear is that it's going to follow them in their academic careers, and so there's a reluctance to reach out for help, especially inside of the institution, and that's where I hope that our phone number can be out there someplace, and that they not hesitate to pick up the phone. We have lots of resources in Kansas City, for example, if that's where they're located, while they're in school. We probably have 15 students from each of the medical schools right now that we're taking care of. Okay. And they're being treated by people there in the Kansas City area.
Really?
So we have lots of resources we can refer people to.
Okay.
But I also don't want to discourage the in-house support that's there.
Okay.
That could be very beneficial and very helpful. As a matter of fact, the last time I presented the suicide program to the medical students over on the UMKC side, the suggestion was made that I spend some time with those people who are providing in-house resources so that we can all kind of work together. Mm-hmm. And so that's on the agenda, probably due in the springtime when I can get up and get out there and get to Kansas City again when life can get back to normal.
Okay. So I'm understanding that, yes, we have resources for our students, and our students have that information. I'll make sure it's included in this class again, but that they can always, if they're the friend of the student who's struggling or the struggling student themselves, they can call on either situation and just be given some next step.
That's right. Right. And at this point, a lady by the name of Kathy will answer the phone, and that's who they should ask for. Yeah, and they'll get directed to those of us who can help provide the resources that we need to provide.
Okay, thank you.
Yeah. As I mentioned in the PowerPoint, we have a relationship with the Board of Healing Arts and the Dental Board, the Board of Narcotics and Dangerous Drugs, and the DEA. We work closely with all of these people. We have a memorandum of understanding with both the Board of Healing Arts and with the Dental Board. And so they make referrals to us, and they stipulate what it is that they expect us to do for their people. We work within a set of guidelines for both of those boards. And so they know what they expect from us. We know what we can expect from them. And over the years, we We have garnered a really healthy relationship with the Board of Healing Arts, particularly in that today, most of the people who are referred to us are referred in lieu of discipline, so that if one gets into trouble, they're sent to us and basically told, you do what these people ask you to do for a length of time, and if you follow the protocol, you will not, your license will not be encumbered because of what it is that they've done. And so that's a tremendous gift. I think we've earned that, and that's because we've done our jobs. You know, we are who we say we are. We do not hide sick doctors. We will never hide a sick doctor. We don't hide any sick medical personnel. They know that. And when we get people, our effort is to get them well and to get them back out there and to be honest and straight with the board. I can't say that enough to your students too in communicating with the board. Honesty is the best policy, straightforward, always.
Okay.
We belong to the Federation, which is probably not something that's of much interest to most people. Federation is a combination of all states in the United States who have physician health programs. And by the way, there are only 2 states that don't have physician health programs. That's Nebraska and California. They have resources, but not physician health programs. But if you're being prepared to go out there into another state, you'll find the exact same program that we have here in Missouri. It will look very much the same. And again, if people need to know how to connect with their program in Iowa or Kansas or Illinois or wherever they're going, we can certainly hook them up because we know all of these people by name and know them personally because we've worked with all of them.
Is the program that you're running in Missouri that takes care of allied health, and that's how we're involved, is it established that way in all the other states? And where do we look to see if we're included?
Well, it again, part of the problem is when you see one PHP, you see one PHP.
Okay.
We all have a variation of what we deal with and who we deal with. That's true. Mm-hmm. I think you just asked the questions, which is what we would do. If we were taking care of an anesthesia assistant who was moving to the state of California, we'd make contact with the PHP in California and say, what are the resources in your state that we can provide services for these people at this level?
Okay.
You know, and most states will have something.
Okay.
Whether it's athletic trainers or it's PTs or it's, speech therapists or whatever, there'll be some resources that are out there. And then it's just a question of finding the people who can find it for us.
Okay.
Where do referrals come from? Historically, self-referrals are becoming more prevalent. Colleagues, again, people who have been taken care of, who received our services, who are excited about what we do, will often make referrals to the program. The boards obviously send a lot of people our way who are impaired. The hospital staff, I dealt this morning with the hospital staff, for example, who has a physician who's 40-some years old, who just had a major stroke. And this doctor is interested in preserving her career as a physician, has tried over the last 2 years to get back into a practice and has struggled like heck. And so the staff is asking us, the medical staff, to see what we can do to get a proper diagnosis, to get this lady or this physician positioned in a workforce where she can be successful again as a doctor, limiting her in whatever way we have to in order for her to be able to survive, but working with the hospital staff to get that done. Medical schools make referrals, families make referrals. I have a lady that I'm working with now who was released from her residency program in surgery because she was abusing her Adderall, consuming 200 and 300 milligrams of Adderall a day, and ended up living with her source for the Adderall and was not able to maintain, her behavior in the context of her training and got kicked out of her training. And so she was sent away for treatment for 90 days in Chicago at a treatment program recognized by the Board of Healing Arts. She has come back. She's in recovery and is now going through match, trying to find another residency to restart her training. Exciting process, but she's doing well. So that was a family referral that initiated that process for her. I'd like to talk about the code of silence has been a pain in my behind for the last 40 years because it is what has kept us from being able to do our jobs in a way that allows us to truly take care of each other, which is again what the AMA declared for all of us to be able to do. And it's been a disservice to the profession is that we've refused to own the fact that sometimes there are practitioners in our presence who really need to be confronted and who need to be dealt with. And most hospitals today have an impaired practitioner committee that people can be referred to and can be referred anonymously so that folks can deal with this issue. I can tell you, if left to its own resources, some of these problems will ultimately lead to a conclusion that is not pretty at all. It can lead to death on the part of the practitioner. It can lead to a challenge to patient safety when practice is going on when there's an impairment that's available or an impairment that's there. And so the code of silence has no place. And let's just make sure that when we get out there doing our profession, that we do not practice the code of silence, but rather take on responsibility for each other as the AMA declared that we needed to do.
And you're talking about a theoretical code of silence, correct? It's not
Yes.
that they're, okay.
No, it's a theoretical issue. Okay, I just want to chat a little bit about a part of training that sometimes gets missed, especially in the medical profession and the training of physicians. And I suspect it may be also true in your training as anesthesia assistants. But it's important not only that you have the technical skills to be able to apply your trade, but that you also develop the character that makes you who you are as you interact with those whom you're trying to take care of. There's an adage that simply says, people don't care what you know until they know that you care. And I can't tell you how important that ability to care for those people that you're going to be serving as an anesthesia assistant, to care for them and to connect with them and to feel with them and to be compassionate toward them at all costs. And that's a side of us that I'm not sure many of our training programs have worked hard at trying to teach us to be aware that there's another side of medicine besides the technical side, and that's the human side. And I'm going to tell you, perhaps even more to help you be more successful in your profession, is the fact that you take care of that human side, is that you become a good technician, which you do need to be. I'm going to reference, in connection to that, Mary, just some things. If I were face to face with the student, I would ask them to do is to connect with a mentor, or to remember a mentor that or someone that led them to even getting into the profession, and what it was that touched them about that particular person. And the charge is to simply, one, be a good listener. To do our jobs well, we need to be good listeners. We need to be respectful. We need to demand respect, and we need to earn respect. Really important pieces in the process of doing our practice. We need compassion, and we need empathy. We need to be nice. We need to be nice people at all times. You can't fake niceness. We need to be real and to do what we promise. We have a charge to do, and we've made some promises, and people expect that. I can say this. I have been on a ventilator. I have had cardiovascular surgery, and I know that when I went down and I went under, I really trusted that you were there and that you were doing what you promised you were going to do when you walked out of your training. And I dare you never to take your practice for granted. It's a gift that you've been given. So please be grateful. Be grateful how lucky you are to have the opportunity that you're about to walk into, and earn your right to be in practice. That's something that you earn. Remember that. Study again, keep learning. And most of all, be a team player. You can't do what you do without being a wonderful team player, because you take your marching orders from somebody else at all times. And so if you're not a good team player, that's not going to go well. And so the challenge, remember, be a team player. It's really critical. That's my sermon for the day, Mary.
That was beautiful, Jim. I loved everything you said.
So here's some mistakes that you need to be aware of, that the board has brought to our attention, that we need to bring to your attention. Is when you fill out all your licensure forms, make sure you fill them out yourself. Don't let anyone else fill them out for you, so that the information that's there is accurate and it's yours and you're responsible for it. Always review documents before you sign for accuracy, no matter what it is. Always make sure, because sometimes they'll slip a piece of paper under you and say, here, sign this. You don't sign anything until you're aware that it is what it's supposed to be, and it's something that you're willing to attach your signature to. The importance of self-revelation. To the Board of Healing Arts, I'm telling you, it's everything. It's everything. And if you reveal your information to the board, I can tell you they treat it with sanctity and with sacredness. I can promise you that. And the key is that you be willing to be honest and open with the Board of Healing Arts.
Jim, a lot of our students are going to stay in Missouri. Yes. A lot of our students will stay in Missouri and practice in Missouri. Yeah. And I'm just wondering what sort of incidents would be included in what they should disclose and what aren't. I didn't know if you could elaborate on that.
Well, I actually, it's a good question. It's very fuzzy to answer. And more often than not, I simply refer people to an attorney.
Okay.
Because it's legal stuff more often than not. But yet the questions, and you've done it. You are an anesthesia assistant.
Yes.
Yes?
Yes.
Okay. You filled out the application. Yes?
Yes.
Were you honest?
Yes.
I'm testing you, Mary. I don't mean that. No, but the questions are easy enough to be able to be led down the line. You know, if they asked, have you been treated for an addiction, a chemical addiction, for example? And, you know, that happens. Or incidences where someone might have received a minor in possession when they were in high school. You know, all that stuff. I can tell you, if you even share stuff like that, or if you do share stuff like that, it's treated with dignity. I mean, they're not going to chase after you just because you've indicated that. But if they see enough of those red flags in the answers that you give, they may refer them to us and say, hey, would you guys take a look at this and see what you think? You know, so I don't have a black and white answer to your question, Mary. Mm-hmm. And you know, that's another question, that if someone has an issue with whether or not they should put it on the application form, give us a call. Give me a call. I'll be happy to discuss it. Ultimately, I'm going to say it's your responsibility, though, to say what it is that needs to be said. Mm-hmm. But I'll give you my advice. Again, I've done this kind of presentation with PAs for years, and I've had a number who have called and said, you know, this happened to me and this happened to me. I was in treatment for an eating disorder back in high school, and do I need to divulge that and all that sort of stuff? Well, we put it in context, and sometimes yes, and sometimes it probably doesn't need to be.
Okay.
But I'm here to just say, don't be afraid if you do feel the need to reveal that it will be mistreated, because it won't be.
Okay.
I can promise you.
Thanks.
Okay, the kinds of things we see: alcohol abuse. Again, the drug of choice among medical personnel still today is alcohol. And of course, you know, we worry about dependence. I have a young resident now that was just referred in the last several months on a Zoom consult, was seen drinking a beer. And let me tell you, the forces that be simply took that issue and he tried to minimize, to say it wasn't any big deal. It was just something that he did. Okay. And so they gave him a second chance there at the hospital. And then a week or two later, he was in the hallway and he asked one of his, one of the attendees for a 7-day supply of Ambien. And this attending happened to be aware of the fact that this physician had been seen drinking a beer in a consult. And so he raised the red flag and said, this doesn't sound good and doesn't sound right. And so he was then referred to our program, and we have subsequently put him on a year of diagnostic monitoring, where he is going to be tested now for the next year to stay away from all addictive chemical substances that aren't referred by a personal physician. Illicit drugs can be an issue. The use of marijuana, prescription drugs, obviously, in the school. Sometimes we're dealing with the issue of Adderall and the abuse of Adderall. It's especially among medical students, it gets abused. That needs to be addressed. Disruptive behavior. Gone are the days that the good old boys control the environment in the hospitals, because they don't anymore. And hospital institutions will no longer put up with behavior that is not decent. It's that whole charge that I just gave you about being nice. That nice will go a whole lot further than being abrupt and disruptive. And you're going to be referred to someone for help if you choose to be disruptive, I can tell you. So we get lots of disruptive behavior referrals. Sexual boundary issues, a very delicate piece. There's just sacred boundaries between you and the patients that you serve, and that needs to be respected at all times. At no time should you ever date a patient. And I would also say, and this comes from me, I would also suggest that you don't date those people you work with. It sets up a very, very complicated connection. And again, just a heads up. Mental health issues, goodness, depression can happen in multitude of ways, and the ways in which it shows its face can sometimes be very disruptive to a practice. Life's issues, relationships break up, divorces happen, and boy, those are life-altering and life-changing events that sometimes we need help to try to traverse through those processes. And it's those kinds of resources that are available. Some of the things you might look out for, significant headaches might be an indication that we're not managing very well, that we're being overly stressed. Undiagnosed depression, and depression often is anger turned inside, I believe. And so there may be some loose anger out there that needs to be addressed. Lack of sleep can really cause major complications in the workplace. Again, when I went under my surgery for open heart, I really prayed that your hands and your head and your heart was as attuned as it could possibly be, that you would take care of me while I went under for my surgery. And so if you lack sleep, sometimes it's very difficult to focus and concentrate, and so it affects the quality of your practice. Burnout simply means it's those occasions when we lack the emotional connection with the people that we're taking care of. We're not robots, we're people. And when we get burnt out, often we find it very difficult to empathize with those that we care for. And if we don't empathize and care, it's very hard sometimes to offer the resource that people are looking to us for. A lack of exercise, issue. Important to do it, if not daily, at least several times a week. Poor diet, long work hours, marital issues, loneliness, inadequate family, friend time. Yep, take care of those who are important to you because you are also important to them. And it does wonders to maintain our energy and our energy pie. DUI, drinking while driving, disruptive behavior, patient complaints, all those are warning signs. Moving from job to job to avoid being found out. Wow, that's one that we try to nip in the bud, and that's why states often will relate to each other about what's going on, and people who go from one state to another to practice, we pass on all the information we can in order to not allow people to simply fall underneath the radar and avoid being found out. Absenteeism, you can't do your job if you're not there, but you also can't do your job if you're there physically and not there emotionally. And so well-being and wellness is really a critical piece of doing your job well. And again, often the work is the last thing to be impacted. When people are distressed, they still tend to be able to work, but everything else falls apart, and then ultimately work falls apart as well. So just some pointers here about how to take care of ourselves in the process. Preserve some of your energy pie every day for yourself, your family, and your friends. And I'm going to share this, and I share this from 40 years of work in my clinic, taking care of patients, taking care of doctors and medical personnel, and running a clinic and doing all the things that I did. What allowed me to be successful was I learned something very early in my career, and that is that every morning I woke up, I had one pie's worth of energy to spend on my day. And I knew that as I walked through my day, that my patients were going to get some of the most precious energy that I have to give, because that's what I was there for. But I also knew something else, that there were some other people in my life who also deserved some of my special energy every day. And so every morning I made sure I made the commitment to preserve a piece of my energy pie for my wife and for my children. My wife and I have 7 children between us, and there are lots of drain on our resources and our energy. But let me tell you, they are the driving force that energizes us to do the things that we do, and certainly was what energized me to do my career. And so I would recommend that you determine your energy pie and that you decide who gets what out of that energy pie. But you make sure you keep some of that for yourself, take care of yourself every day, but also provide some for your family and your loved ones and your significant other and your spouse or whoever it is that drives you. And of course, give what you've got left to those who come to you for care in your practice. And again, elicit unconditional support from your spouse or your partner, and that will come if you're doing a good job of preserving your own energy pie. A sine qua non, that without which most of us will not be successful, is a lack of exercise. We cannot get on without exercise daily, literally, if we can do it, and at least 3 times a week. And again, that comes from experience, boy. It's what helps to build our energy so that we can provide the resources that others expect of us personally and in our careers. Establish regular sleep habits. Learn it now while you're young. Let me tell you, and as you go through your career, good, healthy sleep habits will go a long way to support you in your ability to do your job. Be aware of nutritional intake. You can't always eat lunch and dinner on the run. Sometimes we simply have to stop and make that a real deliberate moment in our day when we sit down to lunch. We shouldn't be working over lunch, certainly. And when we sit down to dinner, perhaps, and hope we can do it with those that we love. But be aware of your nutritional intake along the way. Continue to develop your spiritual life, whatever that may look like. Find quiet time to meditate, be mindful, and be aware of the present moment as much as you can, because there are going to be lots of times when life's going to be coming at you 100 miles an hour. But in the context of that, you've got to be able to step back and take a few minutes for yourself. That's really important.
Jim, I just have a question or a comment. I just wanted to kind of highlight to the students listening that you've been doing this for 40 years and you've seen, I'm sure, the worst of the worst cases and a lot of detrimental issues to people's personal and professional life.
Mary, I could write a book.
Yeah, I'm sure.
I could write a book. And I'm sure I still haven't heard them all, but boy, oh boy.
Well, you're retired, but you're still here, so you've got some time. But I wanted to highlight that the tips that you're giving or the advice that you're giving are things that aren't big picture things. They're small daily tasks, small daily habits that everyone can start doing right now. And that even though it may not seem like avoiding substance use disorders in our profession is intimately linked with what you're eating every day, you're here to say that, in fact, your experience shows that it is.
It is. It is.
Okay.
No question.
I'm with you. I believe that too. I just wanted you to hear you say that taking care of ourselves is the most important thing we can do to avoid all of these issues and to seek the treatment we need.
Yeah, absolutely. Absolutely. Avoid the psychology of postponement. You know, we're going to put it off till tomorrow or put it off till next year. No. Celebrate the now and to stay in the present moment as much as you can. That's where life is. Or those of us in my own spiritual journey, you know, that's where God is. He's right now. This is it. And this is as good as it gets for the moment.
Mm-hmm. I have another question, if you wouldn't mind, just about if we're getting down to the root cause or the root treatment, if you see in your practice that a lot of this goes back to trauma, you know, that a lot of what is needed to heal these people is to heal, you know, old traumas or old shame, or how much that plays into it that you see.
Yeah, it's hard to generalize, but you know it is true. Oftentimes it's that historical trauma that's beneath the surface that one wouldn't see or wouldn't even know about. You know, my stroke patient that I shared with you that I visited with, and you guys are going to hear from Acumen, the neatest program and the neatest people in the whole wide world. I'm telling you. They're miracle workers. I've witnessed it for the last 40 years. They're miracle workers and do a wonderful job. But their ability with this particular stroke patient to be able to unearth some historical trauma underneath that was making her adaptation and adjustment to the physical difficulties that the stroke provided her, that until she was willing and is willing, and she certainly is, to get at the trauma underneath before she could really kind of deal with the trauma on the surface, which was dealing with the stroke piece. So, yeah, many times in dealing with a lot of these issues, there is trauma in the past. Hard to generalize, but it's fact.
Sure.
Nice insight. Thank you, Mary.
Mm-hmm.
And I'm going to kind of draw to a close here. But here's another way of saying what I said here when I began some of these self-care pieces. Behaviorally support what you say you personally value. If you say your health is important, it's important that you act like it, that you put your money where your mouth is, that you put your energy where your heart is. If you say your spouse is important, then it's important that you act like it and that you demonstrate that and that you show that. If you say that God and religion and faith is important to you, then act like it. Then act like it. If your children are important to you, act like it. If your work is important to you, then act like it. Behaviorally support what you say you value. Put your energy and your money in the things that you cherish the most. If your children are your most important piece, act like it. If your spouse is, act like it. If your job is, act like it. Big piece. That's a statement that I have on my bathroom mirror, and it's been there for many years. Behaviorally support Jim what you say you personally value. If you say it's important, act like it. And again, a reminder that we need to take care of each other. Can't say that often enough. Select a mentor with whom you stay connected. Don't wait till the middle of your career, as I did, to look for a mentor. I'm very grateful that I got the charge a few years because I had lots of people that I had associated. The association looks like for your take care of your relationships as well as your practice. And you do that, and you're going to be successful. Keep your head above water, stay honest, be straight, be nice, play fair, be a team player. Good luck. Are you with me?
Yes. Thank you, Jim. I got slowed down again, but yes, thank you so much. I heard the last little bit.
Is this what you wanted?
Yes, it was great. I'm irritated by my connection, but I think it records in real time, so I don't think that will be a problem.
Okay.
And if it is, I will adjust. But yeah. That's, I guess, what we got to do these days. So that's what we did.
That's what we do.
It was great, Jim. Personally,
it's more fun to do this. It's more fun to do this in person.
Oh goodness, yes. Life is more fun in person for sure. But personally, it's very interesting that so much of your work just comes down to the basics. And I really want to give the students that understanding. So after this, we're going to do some work on identifying how they want to feel during each day and how they want their career to feel and what they want to get out of their career, and just starting them thinking of themselves not as money makers or doers, but that our profession is a way to get filled up in the way you want to be filled up. So however that's going to look for you. So I'm going to do some work with them in that, and then also just developing the conversation about starting to feel your best. What do you need to do in terms of nutrition and exercise and that conversation.
Yeah. Nice. So, nice. That's right on.
Awesome.
That's
awesome.
Right on.
Because I just think that since we're talking to students, we have the ability to get it before it really gets bad when they're in the operating room with fentanyl. Now they're just at parties with alcohol, which can be bad, and other drugs. But when you're in front of fentanyl and you've got an issue, that can be quite scary.
Yeah, you're right on.
I had a couple other questions if you have a few minutes. I'm not sure if you're got to go or not.
Oh, that's fine. I'm retired, Mary.
Okay. Personally, I think this is relatable, but I have come across in my career physicians, colleagues, that I have felt were impaired, not always with substances, but maybe what you're talking about, the sexual boundaries or just the interprofessional boundaries that seem to have been crossed, or just something's off.
Yes.
Where does that intuition of CAA, a certified anesthesiologist assistant, come into play with reporting and taking a report to you guys?
I would think that it would be difficult to be heard in your profession.
You mean against the anesthesiologist? Like if you're reporting, if you feel like there's an issue.
Yeah. There's still enough of that good old boy doctor stuff.
Yes.
That nurses have fought for identity, and they're part and parcel of patient care. And so are you all. So is your profession. But you haven't earned that yet. It feels like that. Mm-hmm. That's just a gut reaction from me. But the reality is still there. I mean, you see it, you feel it. You're right on. Certainly, what I would encourage is for someone who becomes aware that there's some boundary concerns here, that there's a supervisor, or there's a director, or there's someone who is in charge, who hopefully would be professional enough that will hear you out, and that the index of awareness or concern might be raised, so that eventually something can be done about it. I mean, you talk about those sort of subtle hints that there's something not quite right here, which you can't really sometimes put your finger on it, although you feel it.
Mm-hmm.
And your hope is that others become aware that there's something that doesn't seem to be right if it's at that level. Now, if it's an obvious violation, then no question, you go for it, because the environment is such out there today that people will be heard.
Meaning contact you. Meaning going for it is contacting you.
Well, going for again, be aware of what is available in your institution.
Okay.
You got to work there too. In other words, we're going to get people come to us when it has reached that institutional level.
Okay.
I mean, you can consult with me and say, Jim, I've got this person. What am I going to do here? I'm probably going to turn you back to the institutional resources and to say, okay, let's start at that level and let's figure out where it can take us. Okay. And then if it's determined that it's serious enough, then, you can turn that person over to the Board of Healing Arts. You can write a complaint to the board, anonymous complaint.
Mm-hmm.
If that's what it has to be, so
yeah,
you kind of start there, but again, find out what's in the institution. Have your students be aware of what's available in their particular institutions, that there is a practitioner, impaired practitioner. It's not called that anymore. It's probably called a wellness committee these days.
Mm-hmm.
That's in their hospital. That's what that's about.
Okay.
That's what that's about.
So going to the HR if you're a hospital employee and finding your resources, and if you're a private anesthesia group employee, you're going to have to talk to likely an anesthesiologist who's in charge about a colleague. Yes. Okay.
Yes. And most hospitals will have EAP programs, an employee assistance program. You familiar with them?
No.
It's like a PHP, actually. And that's how, as I said, that's how I built my first PHP, was out of an EAP program. But what it is hospitals will provide resources to employees who have personal problems, and they'll have resources available to their employees, therapy or whatever. And in our hospital, for example, we provide 6 free services to any employee who has a personal problem and needs help. That's a nice gift. It's a nice perk. It's a good place to start.
Okay.
It's a good place to start for your student.
Wonderful. Yeah, it sounds similar to what's offered through UMKC Medical School. All our students have 6 free therapy sessions.
Same thing. Kind of the same thing.
Yeah.
Yeah.
Okay.
It's called EAP, Employee Assistance.
Okay. Got it. All right. So we just need to, we're charged with taking care of each other, taking care of ourselves.
Yes.
Being our own advocate, being an advocate for our colleagues.
So that we can take care of our patients.
So we can take care of our patients, yes. Yeah. Awesome.
Nice.
Thank you so much, Jim.
That was a nice package.
Wonderful.